Good morning, Hudson Valley.
Ear doctors performing facelifts? Well, apparently it happens, as cited in a recent New York Times article. The article also mentioned how some patients are receiving cosmetic procedures like breast augmentation, tummy tucks, and liposuction from ophthalmologists, oral surgeons, gynecologists, and even family practice physicians. And these findings were also backed up by a recent article in USA Today. Well, unfortunately, it doesn't stop there. In addition, the New York State Senate is currently considering legislation regarding oral surgeons and cosmetic surgery, which was reintroduced in the New York State Senate at the beginning of January. According to Adam Schaffner, MD, FACS, one of Manhattan's premier plastic surgeons, the American Society of Plastic Surgeons is working closely with the Medical Society of the State of New York and other coalition partners to aggressively oppose this bill for a second time. We should tell you that Dr. Schaffner is a New York City plastic surgeon who specializes in aesthetic plastic surgery of the face, breast, and body. Dr. Schaffner is unique in that he is also board certified and fellowship trained in facial plastic surgery and head and neck surgery as well. He currently serves as director of JUVA, J-U-V-A, plastic surgery in Manhattan. I'm very happy to welcome Dr. Adam Schaffner to Good Morning Hudson Valley.
Good morning. Thank you so much for having me.
Sure, Dr. Schaffner. The fact that these, and I'm certainly not attempting to cast a pall over the medical community or anything, but the fact that it is being done, that doctors, apparently in some of them anyway, hopefully a small number, are practicing outside their area of specialty and expertise when it comes to plastic surgery.
Well, I would agree with your assessment there, and certainly the articles that you cited in the New York Times as well as USA Today go into some detail about that. But I think what the listeners need to really know is that any doctor can call himself or herself an aesthetic or cosmetic surgeon. So it's important to do your homework if you're thinking about having plastic surgery to make sure that your plastic surgeon is in fact a plastic surgeon and not just a cosmetic or aesthetic surgeon who is trained in another area of medicine and then has decided to perform plastic surgery type procedures.
Now, you're not only a plastic surgeon, a noted plastic surgeon, but I believe you also train in this area.
That's exactly right. So I am someone who trained originally in ear, nose, and throat surgery and then decided that I wanted to perform plastic surgery procedures and therefore went back and did the formal training pathway, which is a plastic surgery residency, and also completed fellowships in both facial plastic surgery as well as aesthetic and breast plastic surgery. And that's what I would encourage any doctor to do who's considering performing plastic surgery procedures because nobody comes straight out of medical school going right into plastic surgery. You go through some sort of prerequisite pathway to qualify you to pursue plastic surgery training, either through general surgery or head and neck surgery or a number of other areas, and it's important to complete that process to make sure that you're prepared to handle not only some of the more simple cases, but also the complex and revision cases as well.
What we're talking about this proposed legislation in the New York State Senate that was recently introduced. What is this about, and why is your group opposing it?
What it's about is basically trying to find a way to circumvent the educational and credentialing process by having New York State lawmakers state that oral surgeons can perform cosmetic and plastic surgery procedures, as defined as any procedure in the head and neck region, without having the plastic surgery training. And the concern is that this may very well put the public at risk for significant harm by having healthcare professionals perform procedures in which they lack the knowledge, training, or skill compared to the procedures in which they spent years performing in their field of expertise. And I think it's necessary that someone have an MD or DO degree, a medical doctor degree, and then complete the appropriate plastic surgery training and then become board certified in that field to be prepared to properly care for patients in plastic surgery.
So I think what I hear you saying is that anyone considering plastic surgery or a cosmetic procedure really should do their homework and find a physician who has been trained and who is certified in that area.
That's exactly right. So when the doctor says he or she is quote-unquote board certified, the real question that should be asked, board certified in what? They could be board certified in a number of specialties which are available, such as internal medicine or obstetrics and gynecology. But that doesn't necessarily mean that because they're board certified in that specialty that they are qualified to perform plastic surgery.
Where can someone who is considering a procedure or just to get more information in general, how can they go about that?
Absolutely. Well, I think that the first thing to do is to ask the doctor who they are considering whether or not that they're board certified in what specialty. You want to make sure that that person specializes in the procedure that you're interested in. Make sure they have hospital privileges for the procedure and that they operate in an accredited facility. I would recommend that they ask to see before and after photos and ask to speak with patients on whom that plastic surgeon has performed the procedure in which they're interested. If they have an academic appointment where they're teaching other doctors who are in training to become plastic surgeons, that's an added bonus. And, of course, make sure you feel comfortable. And they can always go to my website, www.drschaffner, DRSCHAFFNER, or call us at the office at 212-688-6600, and we'll be glad to answer any questions or help guide people in their quest to find a qualified plastic surgeon. And, of course, if they're here in the New York area and they'd like to see me, I'd be more than happy to help.
Dr. Adam Schaffner, thank you very much for being our guest this morning.
My pleasure. Thank you so much.
Thank you.